Hi, I'm Dr. Malpani. I'm an IVF specialist. And I'm going to talk to you a little bit about IUIs and IVF because this is one of those topics where patients are very confused. And part of the reason for the confusion is the advice which the doctors give them. And often the advice is very conflicting. Most infertile couples, when they have a problem getting pregnant, will go to their gynecologist because, of course, it's always the wife's fault she's not getting pregnant. And the gynecologist will do the standard tests, starting with the man's sperm test, hopefully first. And if that's normal, they'll then test the wife. And if everything seems to be fine, then the label is unexplained infertility, or they'll be able to find a particular problem and then create a diagnosis. But let's suppose the problem is unexplained infertility, or let's say the man has a low sperm count. Then a lot of the gynecologists will tell patients what you need to do is called an IUI or an artificial insemination. And what their explanation for this is all your tests are normal, the uterus is fine, the tubes are open, the eggs are okay. For some reason, the eggs and sperms are not meeting. So, what we will do will be an intrauterine insemination, which logically makes a lot of sense, which means we'll give you tablets and injections to help you to grow lots of eggs. That's called superovulation. We'll monitor with ultrasound scans to check exactly when the follicles mature and when they rupture. And at the point when they rupture, we'll wash your husband's sperms and inject them directly inside the uterus to increase the chance of the eggs and sperm meeting. Now, IUI is an excellent treatment for a certain group of couples, especially, for example, for couples with unexplained infertility, where you really don't know what's going wrong. But this means that the tests have been done properly, and sadly, a lot of the times our tests are not done properly. But the basics should be the HSG should show the tubes are open, the blood tests, including FSH, LH, prolactin, TSH, and AMH, should be normal, and the sperm count done from a reliable lab should be normal. And if the couple has been trying regularly for a year and still not got pregnant, then the diagnosis is unexplained infertility, and then it makes sense to do the IUI because you are increasing the chance of the egg and sperm meeting. Two or three caveats which you must remember. One is that ideally the IUI should be done in a dedicated clinic. Typically, what happens is gynecologists don't want to refer patients to infertility specialists, so they just try to do everything themselves, which means they will refer the patient for the ultrasound scans to a sonographer, and then the sonographer will monitor it. And when the follicles burst, they will then refer the husband to a laboratory who will wash the sperms, and then the husband will come back with the washed sperm to the gynecologist who will then insert them inside. That actually makes no sense at all because everything gets fragmented and siloed, and then the sonographer doesn't know what he's looking for, and he may often miss subtle findings. The gynecologist themselves is only just doing the actual procedure, is not monitoring any of the stuff. So there's a lot of dependence on the part of the gynecologist on both the laboratory as well as the sonographer, and that's definitely not in the patient's best interest. So your best bet is to find a specialist where everything is done under one roof. The sperm sample is washed in the clinic itself because by the time you bring the washed sample back to the clinic, and if the doctor is too busy, the sample quality will keep on deteriorating. And ideally, the sonographers should be in the clinic itself because then your quality of care increases, because in case the cycle fails, you know exactly what to do differently the next time. Whereas if on the other hand you're shuttled like a tennis ball from the sonographer to the doctor's clinic to the andrologist to the lab, what happens is the left hand doesn't know what the right hand is doing. You end up getting a raw deal, and that's very poor quality treatment, and that's not in your best interests. The important thing to remember with IUI treatment is the key is superovulation, which means you need to increase the number of follicles, which is why we use medications like letrozole and injections. Ideally, you want at least 2 to 3 follicles. If you're only getting one follicle, then you're really not superovulating effectively. And on the other hand, you don't want too many follicles because otherwise you increase the risk of a multiple pregnancy as well as hyperstimulation. And that's why it's so important that you do your homework and understand exactly what the doctor is doing and find a clinic where everything is done under one roof so you don't have to run from pillar to post. Because then, even if the treatment is the right treatment for you, if you do the right treatment in the wrong place, you're not going to get good quality results. Please understand that. I hope this clarifies some of your doubts about IUI treatment. And if you have any other questions, please feel free to reach out to us. Our website is www.drmalpani.com. We're an IVF clinic. We've been doing IVF for over 30 years. There's tons more information and lots of videos on our website. And if you have questions, I'm happy to offer you a free second opinion by email on our website. Look forward to seeing you online.